Throughout her life, Dr. Barfield has always been drawn to look out for the little ones. As a child, she was certain she would become a veterinarian and spend her life caring for animals large and small. It didn't quite go that way, although she did end up caring for the smallest of us. After her graduate studies at Harvard Medical School and Harvard School of Public Health, she became a neonatologist. She has now spent over 30 years at the highest levels of the U.S. military and U.S. Public Health Service, dedicated to the improvement of outcomes for mothers and infants and the advancement of public health. Growing up in a military family, Dr. Barfield had seen the benefits of military service and decided to join the United States Army Reserves through the Health Professions Scholarship Program. Being in the military gave her opportunities to serve in leadership roles early in her career. While serving as the director of the Neonatal Intensive Care Unit at Madigan Army Medical Center, Dr. Barfield provided direct care to critically ill and premature newborns of a diverse cadre of uniformed services families. She also had the distinct honor of being part of the Western Regional Medical Command, which meant caring for patients referred from military facilities throughout the western region of the U.S., from Hawaii to Alaska to the southwest United States. In 1999, Dr. Barfield deployed overseas for a mission with the Multinational Force and Observers, an international peacekeeping effort between Egypt and Israel, initiated by the Carter administration in the Sinai Desert. This experience helped set the stage for a career in public health and emergency response. In 2000, Dr. Barfield joined the Centers for Disease Control and Prevention's Epidemic Intelligence Service, or EIS, a program that provides rigorous training and experience in public health science and frontline public health response. In September 2001, Dr. Barfield deployed to New York to respond to the 9/11 terrorist attack, shortly after giving birth to her first son. Dr. Barfield and others in the EIS class worked on syndromic surveillance and spent their deployment assessing potential risks of biologic warfare by appraising any unusual symptoms in nearby hospitals. Although it was difficult to deploy with a newborn, Dr. Barfield was driven to continue her work and to rise to the challenge. In 2010, Dr. Barfield was named Director of CDC's Division of Reproductive Health. As DRH Director, Dr. Barfield has led efforts to promote optimal and equitable health in women and infants through public health surveillance, research, leadership, and partnership to move science to practice. Under her leadership, the Division of Reproductive Health works to build surveillance efforts to understand maternal mortality, translate data to action to improve the quality of care for mothers and babies, collect better data on women and infants, address opioid use disorder before, during, and after pregnancy, prevent sudden unexpected infant deaths, and more. In 2017, Dr. Barfield was promoted to Rear Admiral, becoming part of a highly select cadre of professionals, providing leadership within the agency and serving as an Assistant Surgeon General until her retirement from the U.S. Public Health Service in 2020. Dr. Barfield's military and public health experiences have helped her serve and lead during many public health emergencies, including 9/11, Hurricanes Rita and Gustav, H1N1, Ebola, Zika, and most recently, the COVID-19 pandemic. She directed the division to develop an emergency preparedness and response team, which is critical for preparedness to respond and protect pregnant and postpartum women from emerging public health threats. But Dr. Barfield doesn't just serve the public, she is a mother, and the strengths that serve her in motherhood, including patience, empathy, and dedication, are also what make her an exceptional leader. In the military and in civilian life, leadership is service. Medicine and public health are service-driven fields. We want to help people. We want to improve quality of life and save lives. As a military, public health, and medical professional, Dr. Barfield's entire career has been about service.
I am passionate about the need to improve outcomes, and so I'm driven every day to meet that goal. Optimal and equitable reproductive health for all is my vision to improve the health of pregnant women, infants, and families.